We've been dispatched to a 21-year-old female who's experiencing strong contractions. The patient is located in Manukau, so the nearest hospital is Minimal Hospital. We've made sure the scene is safe. We've got our PPE on, our gloves and our glasses. I'm going to ask my offside if she's happy to approach. Do you know you're happy to approach the patient? Yes. Okay. We are on scene and we're now going to approach the patient. Hi Manisha, my name is Christian, this is Tina. We're from the ambulance. Could you just tell us what's been happening?
I'm having really bad contractions.
Alright, my co-worker Tina here is just going to get your blood pressure and some vitals. Is that alright?
That's okay.
Okay, cool. Tina, if you could just grab blood pressure, heart rate and her temperature as well. I'm just going to grab a towel. I'm just going to place it under your legs. Manisha to catch any fluids, and also I'm also applying a fluid or incontinence sheet underneath. This will help us to measure the amount of blood loss and any other fluids. Manisha, could you just tell me how far along you are?
38 weeks and 5 days.
38 weeks and 5 days. Alright, so when are you due?
Next week.
Next week. Alright, how's your pregnancy been so far?
It's good.
Good, no complications. Okay. And is this your first pregnancy?
Yes.
So it's your first birth as well?
Yeah.
Alright, so the patient's gravity parity is 0, 0. And have you had any antenatal care?
Yes.
Yes, alright. Do you have a midwife?
Yeah, she's on her way.
She's on her way, so she's been contacted. Alright, that's great. I'm just going to assess your vagina area. Is that okay?
Yeah, that's okay.
So looking at it now, it's about 2 centimeters dilated, the cervix, and the patient isn't in that much pain. I can see that she's talking to me, she's opening her eyes spontaneously, able to obey commands, and she is oriented, so she's a GC 15. How far apart have your contractions been? About 7 minutes.
Yeah.
Right, so I'm thinking the patient is most likely in the later phase of stage 1 labour. So that's because her contractions haven't been dilating the cervix very fast, and she's not having them too close together. Have you had any blood or like mucus blood? No?
Yes.
Yes, and when was that?
Last night.
When did your water break?
About 20 minutes ago.
20 minutes ago. Alright, so her water's broken, she's had the show. And can you describe your contractions now for me? It's really painful. Alright, would you like some pain relief for that?
Yes, please.
Alright, we'll give you that in a minute. Tina, how are the patient's vitals?
So she had a heart rate of about 90, 120 over 80 for blood pressure, and temperature of 36.
Good, so those are good vitals, tells me the patient's not tachycardic or hypertensive. So Tina, if you could just for me count her contractions, the time between it, and also would you like a pillow behind your back, Manisha?
Yes.
Yes. And are you happy in this position?
Yes.
Yes, okay, just let us know if you'd like us to move you to a squatting position or anything.
Okay.
So continue to count those contractions for me. I'm going to administer methoxyflurane for the patient's pain. On a scale of 1 to 10, how bad is your pain? That's 8 and 8, okay? So that's quite severe. So methoxyflurane is indicated for moderate to severe pain. Just get my offside to the drug check.
Methoxyflurane 3 mils expires 2019.
Great, right, yep, and methoxyflurane 3 mils expires 2019. So Manisha, have you had methoxyflurane in the past week?
No.
No. Are you allergic to it?
No.
Do you have any known renal impairments?
No.
And do you or your family have a history of malignant hypothermia?
No.
And she's able to obey commands. So I'm just going to give you this. Just inhale and exhale through the inhaler. This is going to help with your pain. A caution of methoxyflurane is preeclampsia pregnancy, and she doesn't have that, so that's fine. And how far apart the contractions now, Tina?
4 minutes now.
4 minutes now. So I'm just going to assess the cervix again. Yep. And she's having some quite strong contractions, and so I believe that she's in the active stage or active phase of stage 1 labour, because the cervix is dilating quite fast now. It's about 7 centimetres. Right, so I'm just going to apply some pressure to the perineum with this pad. Yep, and the cervix is fully dilated now. It's about 10 centimetres. Alright. So Tina, if you could just pass me a towel, and if you could get the BVA kit and the BVM kit ready. Just keep breathing, Manisha. In and out, keep breathing. She's got the urge to bear down, which tells me she's definitely in stage 2 of labour, in the active phase as well. So just push when you're ready. The head is now come out. And just breathe. You're doing so well. Yeah. Just breathe. The shoulders are out. The majority of the body is out. Just keep breathing. Good job. Alright, what's the time, Tina?
Yep, so we're at 18:05.
18:05 is the time of birth, and then you can see the patient's baby is crying as I stimulate it. We've got the umbilical cord out as well. We're not going to cut it or clamp it yet. So I'm going to gain an APGAR score. So with this patient, the activity is good. The patient baby is moving. There is a pulse that I'll need to check for using the stethoscope to auscultate. So I'm just going to do that. And there is a pulse, and it is about 110 beats per minute, which is good. The patient is grimacing, so there is a cry. She's coughing a little bit. The appearance of the patient baby doesn't appear to be very blue, only a little, which is quite normal for newborns. So I'll give it a 1 for skin, and respirations, it is breathing for itself. So the baby has an APGAR score of 9, which is good. Tina, if I could please just get you to gain another set of vitals for the mother, please. And I'm going to focus on the birth of the placenta. So you're doing really good. Just keep breathing and push when you're ready. Yep, good. And push when you're ready. Alright, so the placenta is now fully out. I'm going to assess the placenta, check that there's no chunks missing, making sure we've got a container or biohazard bag ready to store it in, and the placenta appears to be in good condition, and we would label it as well. With the umbilical cord, we would clamp it at 10 centimetres and 15 centimetres, and I would consider asking the patient who she would like to cut it for a family member or the father, and also with the placenta, we're keeping it to make sure that we're respecting the mother and her birthing plan and her cultural considerations, that she might want to keep it or plant it and whatnot. So we've done all of this. The mother appears to have a GCS of 15 still. She's opening her eyes spontaneously, able to obey commands, and she's oriented, which is good. How are the patient's vitals?
Yep, so 120/80 again, temperature 35 and heart rate
90, which is good. So there isn't any decline in her vitals, still quite stable. And we'll just place the placenta in the biohazard bag. Alright, so the midwife has now arrived on scene, and I would just consider asking the midwife, Natalie, if she's happy to keep mum and the baby at home, because we're quite happy to keep mum and baby at home. Mum appears quite healthy, and so does baby, but if not, then we're happy to transport both of them to the hospital. The nearest one is Middlemore. I would get my offsider to get the ambulance ready, keep it warm for the baby, and we would then transport